So most providers have heard headlines, but when it comes to Alzheimer's, a lot of what you think you know just isn't true. Let's clear up the 5 biggest myths that are holding prevention back, because the truth is there's a lot of confusion out there. And it's not just the patients, even the providers are using outdated assumptions. Myth number 5, cognitive testing equals brain health. Wrong. We did an MMSE or a MOCA and the patient's fine. That's like saying the patient's treadmill was normal and they don't need a cholesterol check. We don't wait for function to fail before testing biology. Cognitive tests check for damage. They check for function issues. BAT tests check for changes that are happening, so you can intervene early enough to do something about it. Function and biology. Myth number 4, treatment means lifelong medication like statins. Not the case. When you do something like a BAT pill protocol, which is what we call our treatment protocol, it reduces the BAT levels in a short 8-week cycle, and it's not a daily pill. It's not a forever plan. Most patients don't even need to do more than 1 cycle to significantly reduce BAT levels. They can just do 1 targeted intervention and do follow-up monitoring, just like you do with A1C or LDL. You watch it over time. Myth number 3, there's no point in testing. There's nothing I can do. Outdated, flat out wrong. We can now test, we can now track, and we can now treat the number 1 risk factor for Alzheimer's long before any symptoms occur. We now have protocols that can reduce BAT levels, beta amyloid and tau. Within weeks, not years, you can remove decades of buildup in just a few weeks. It's no different than treating cholesterol to avoid a heart attack. Myth number 2, it starts at 65. We'll just screen when they're 65 because that's what the government says right now. Wrong. That's way too late. Biomarker changes start in the late 30s, early 40s, and it develops over time. You might see Alzheimer's starting at 65, but by then it's almost too late. Damage is already happening. So if we wait for these memory issues to surface, that's about 20 to 30 years too late. The biology window is basically when biomarkers start appearing. That's the time to intervene. Myth number 1, it's all genetic. If you don't have the APO4 gene markers, you're good. False. The APO4 gene is a risk factor. It's not destiny. And most people who get Alzheimer's don't even carry both variants. In fact, you can have both variants of that gene and never get Alzheimer's. Or you can have no gene markers whatsoever and still see major beta amyloid and tau buildup. It's not just about one gene. It's about biological systems that break down over time. So yes, it's time to rethink what you know about Alzheimer's, because it's not inevitable, it's not untreatable, and it's not something you want to put off. Treat later. Would you do that with cholesterol, high cholesterol? Oh, I'll just wait for the heart attack to happen. No, you wouldn't. We've got the tools, we've got the timing, and we now need to use them. Knowledge is power. Keep watching more.